Welcome to the DKA channel, where every conversation we have here is what? Real. I am David and a registered nurse in the Seattle area. I'm your host today. If you are a nurse or you're a nursing student and you don't know where to start your career, or you have any interest in any particular kind of nursing and you want to know how to start or how to go about it, this is the show for you. So stay tuned and let's get into it. I have two amazing people here with me that I'm going to introduce to you. I have Danielle here on my left, who is going to tell you a little more about herself in a little bit here. And I have Katrina on my right here, who is also going to tell you a little more about herself and in a little bit here. Ladies, welcome to the DKA show.
Thank you.
Thank you.
Let's start from Danielle. Danielle, can you tell us a little bit about yourself?
Yes, I am a nurse for 24 years. I grew up in this area. My whole family is nursing, and I actually really love being a nurse, even on the difficult days.
I really like that, on the difficult days. And Katrina, can you tell us a little more about yourself?
Yeah, I'm Katrina. I'm actually a nursing student. I'm in my last quarter of nursing school, so I'm getting ready to take the NCLEX and be a nurse.
Yeah, I mean, Katrina told me today that actually today was your last clinicals in nursing school. Yay!
Yay!
Well, I know that feeling, the excitement that you are done. Yeah. Mm-hmm. So, well, congratulations in advance, because you are getting ready to get out of that place.
Thank goodness.
So anyway, we are going to talk about, how nursing students sometimes have challenges in making decisions, in knowing where to start their career from. And so we're going to ask a few questions here. Katrina, let me start from you. Do you know what kind of nurse you want to be?
Not completely. I'm one of those people who I would love to work either in pediatrics or adults. I'm drawn to both, but I also know, as a novice nurse, I need to build my skills, my confidence. So I'm looking more med-surg, whether it's like a neuro-tele, just tele, or specific just med-surg, just to kind of work on those skills and learn to prioritize. And eventually my dream would be like NICU, but we'll get there.
Yeah, I know, which is very typical for a new nurse, right? Who is graduating, you're always thinking about, where to start, or you might have something in mind and you go like, oh, I would like to go to this particular area. Myself, I remember having interest in going to the ICU, because initially I was thinking about going to a CRNA school, because I wanted to be a CRNA before, but I think I've had a change of mind, and thank goodness I didn't have to go that route, because I don't want that now, actually. Yeah. But if you want to do that, good for you, go for it. I always say, if go and chase your dreams. If you want to do something, go for it. And Danielle, before you graduated nursing school, did you have any particular interest in mind, any particular unit that you wanted to work?
Yes, I actually was going to follow my parents' dreams, or parents' goals, and they were trauma ICU nurses, as well as my mom did a little bit of everything, including neonatal, and both parents did pediatrics. And so I was going to do that. And upon graduation, I decided I needed to start at med-surg and start, at the lower and get organized and understand my skills. And so I started on med-surg, and now it has tele. Sadly, they just left our floor, but we still do tele. And I returned there after traveling for a year, and I've been back for 19 years. So I really do like med-surg.
Oh, nice. And I remember, like I said, I was thinking about other places too, but eventually ended up doing switching to acute care, right, instead of going to. So Katrina, you are graduating and you are thinking about all these places that you want to work with. If you have to narrow it down, would you be more open to having starting somewhere else, or you would like to stick to what you plan to do, like the type of nursing you want to be?
For me, I'm pretty flexible and adaptable. So I feel like I know I don't wants. Like you won't find me in psych, you know. But I think for me, as long as I find a unit, I'm looking for a unit that has a good like working culture. I'm looking at just the hospital in general, like the benefits they provide, and do they have a good like culture for new grads as well, and a unit where I can learn to get my skills and get it together, because as novices we really don't know much.
And Katrina, do you have any questions you want to ask Danielle?
Yeah, so if you are a new grad nurse and you have a specialty in mind, do you fight for that specialty and that position until you get it, even if you keep getting rejected, or do you recommend going off and trying other areas of nursing?
I actually would recommend trying other areas of nursing, because when I was graduating and in 2001, been a nurse for a long time, and I decided I needed med surg before doing ICU or any other specialty. I interviewed at Children's because I was interested in there, and I also interviewed at UW on 2 different floors, and decided neurosurge and Odo with trachs and stuff. It was kind of close to the ICU, and they would give me that experience. They also have other things there, lots more. It would give me experience close to ICU, and if I wanted to, I could transition pretty easily. And then, lo and behold, I also wanted to travel and do travel nursing, so I did that for a year. My husband came with me, so I got pregnant, and then we got pregnant. We came home, and I've been back because I chose to come back because I really liked it, and thinking after kids I might start the ICU, but I've continued to like my patients. Crazy and all sometimes, because I feel like I'm always learning, and I choose to always learn. While some people can go to the ICU and want to learn more and do other things, I also like my patients talking, and I like the fight between the real sick patients and teetering going ICU and being that advocate for that patient and working really hard to figure out, are they safe at the floor level, or do they need to go to the ICU?
And I think I agree with you on what you said in terms of exploring other fields. Just because I haven't been a nurse as long as you have, so for sure. But I kind of feel like I mentioned earlier, right? Having a little bit of that skill, right, or common skill that every nurse need. Sometimes you will not get that in a particular specialty, right? Because I practice 2 different kind of nursing, with acute care and also with mental health. And I realized that, and sometimes I had done a little bit of addiction recovery. And in all these areas, the type of nursing we do is completely different. The focus assessments we do on each place, the kind of medications you give, you might have 1 or 2 that are overlapping, but most of the times are completely different. So I can see where if one person, if you have in one particular area for a long time, it's difficult to transition into another field because you don't have the skills and how nursing is practiced in that area. For instance, if you ask me to go do like a public health nursing like this, I would be lost. I wouldn't know where to start because that is not my specialty, right? But I think the basic, skills of caring for patients, especially with acute care, is very necessary for every nurse. It's my opinion, though. For you, Katrina, like you said, I think you said you wanted to eventually get into NICU. So, as Danielle was saying, like having that background will be helpful. You are open to trying other things.
I really think for me, I'm adaptable, and I end up let's say I'm in clinical, every quarter we have a different clinical rotation, and I end up finding aspects of it that I like. And again, I have my few things, I'm not going to do that, but for the most part, I know that I need to build skills, and I'm not super confident yet. And in a NICU, I mean, it's intensive care, right? With the neonates, you need to be able to think quickly. You need to do that critical thinking and judgment. And so you need to build those skills, right?
Yeah.
And like, so I think some type of med surge, and then eventually I am drawn to critical care. Anytime there's a code at clinical, I'm like, woo, I want to go watch. But yeah, I think we'll see where the journey takes me.
Yeah. Hey, if you want the full version where you can enjoy in-depth discussion on this topic, please go to the podcast on YouTube or Spotify. And how you get there is that you go to the DKA channel and go under the channel. You will see videos, podcast, and I think food. Go to podcast, and then when you click podcast, you can get the full version. Or just search on Spotify, the DKA channel, and you get a full version on there. Also, we have shorts on TikTok if you want just short versions to watch. Yeah, you can get on TikTok. So let's continue here. Tell us more about you. You did a little bit of traveling, and then you did a little bit of other. I don't know what. When you traveled, did you float? Did you
yes.
work on other units?
Yes.
Yeah.
So I traveled and worked in St. Louis for 6 months, and I was primarily on a thoracic lung transplant floor, but it was a fairly small floor, and it actually was adjacent with a step-down unit. So when the floor was low census and had floor patients, they often moved them into the step-down unit and would tell me, even though I'm not the step-down unit, can you come here? And I was like, well, they were like, we'll give you the floor care patients. And all the staff was really helpful. But as a traveler, you are also the first to float. And the hospital there was 950 plus beds. And so it was quite ginormous. And days and nights, we had a lot of patients. Usually day shift was 5 to 6, maybe 7, and night shift was anywhere from 6 to 8. And even on the thoracic floor, we had patients that were all on tele, and they all, because of the lung transplants, they had anywhere from 2 to 5 chest tubes. And during day shift, you had to get them up and walk.
Wow.
Busy floor.
And then going to the med surge units, they were all on tele, and they were all in isolation. And then you had to get them places, and they didn't have a tube station, so you had to get stat labs to the lab that were sitting at the front desk. So it was a very interesting and challenging floor, but I learned to really communicate really well with the team and the doctors and what I liked and didn't like. And then in Savannah, I worked on a vascular floor / neurosurge, but mainly the vascular. And I did all night shift there. So I came in and I would have anywhere from 4 to 8 patients. And if I had 4 patients by 11 o'clock, I did have the 7th and 8th patient by then. And we did get a lot of overflow. So I did see a lot. I didn't float a ton there because I always got patients. But we saw a lot of different types of wounds and different ways to practice, and I learned a lot. And I learned to really be that hospital. I learned really to be very strong with the doctors, because it was always harder to get a hold of them. And I worked with more attendings than residents in St. Louis or in Savannah.
Yeah. Well, so I mean, so that's you a lot of let's say nursing that you've done in this time period, right? Traveling around and doing different kind of nursing. Would you at this point say a new grad, let's say Katrina here, if you would recommend whatever specialty they want to go in or whatever, like you were saying, maybe you recommend they start trying something else. Do you think that experience really built you up for where you are right now in terms of your skills, knowledge, and then would you have done it any different?
Yes, I do think it builds you up, and it makes you kind of a stronger nurse, makes you a little bit more versatile, starting at a med surg unit. But it's such a broad thing that there's so much different learning, and because we have to deal with speaking to patients that don't have their voice anymore because of trachs, and there's a lot of infections and things like that. And then we get all the medication background for them. like there's medications that my ICU parents weren't as familiar with because they were always just giving ICU meds, and their patients were trauma and always on a drip, and never speaking to them until they got a little bit more stable. And so I do feel like the floor helps. And my sister is also a nurse, and she's a NICU nurse, and she went straight to the NICU, and she loved it. And then and she's great, but even with like our parents being in the hospital and stuff, there was things that were out of her scope because she's so used to a little bit teeny tiny babies. And I at first wanted my senior paper in high school was what causes premature births, and that's what I did as my job shadowing, 2 night shift rotations, holding a 1-pound baby. Precious. So I did love my babies. Now I don't want to be a baby nurse. I would like to go volunteer and rock them.
I think well, I like babies when they're not sick. I don't think I
love babies.
I don't want to go into any pediatrics. I've never had interest. I hated the whole topic in nursing school.
I remember you telling me that.
And not because I don't think it was nice, just because of the way I learned. I kind of learned with by understanding concepts and stuff like that, right? But I think with the peds, there were certain things like from age this to this is your behavior and stuff like that. Those things are things you just can't learn as a concept. You have to memorize them.
I think what I like about pediatrics, though, what draws me to pediatrics, is I do like that challenge of learning how to communicate with different age groups.
Oh, okay.
And I like that. Because I know NICU, you're just comforting them, right? I mean, but working with an 8-year-old is going to be different than a 15-year-old. And when I did a rotation at Seattle Children's, I even had 21-year-olds, and like that was a different communication style. And I love family-centered care. I really am drawn to it. I love working with parents. Could be because I'm a parent. I don't know. But it's definitely just how I work. But yeah, I mean, it's not going to be for everyone.
Definitely.
A lot of my classmates are like, no, I would never touch children.
Definitely not for everyone. Definitely not for me. I don't see myself heading in that direction either now or in the future. So
that's okay.
But kudos to those who are interested, kudos to those who like it and stuff like that. Danielle, you said your sister also is it NICU?
She's the NICU, but she just recently moved into a clinic with kids, but an oncology clinic, which I was surprised. Actually, that was her original plan, but because she did her senior practicum in nursing school in the NICU, she fell in love with that, and then she did that for a long, long time, and then she just transitioned into a clinic with oncology and pediatrics, and she's, last time I spoke with her, she's loving it. I was a little like, that could be sad because all these kids have cancer, and she even had a patient that was with a glio, and when we hear that in adult terms, it's it's kind of a sad terminology that death is not far out, and it's management of their illness and just prolonging their life as long as they are comfortable. And she said that there's a lot of treatments and kids have a lot more resilience and recovery rate, which is a little bit different, but can still be sad.
Yeah, when I was at Seattle Children's, we were on their blood oncology unit. And I thought going into it was going to be incredibly sad, also being a mom. But they're little superheroes, and I thought it was amazing. They're so tough. And the culture they created, the nurses, they try to make it as normal as possible for them. There were toys everywhere, like we're chasing kids up and down the hallway. Like, it was a lot of fun. Drawing.
Kids. But there is some sad times.
Of course.
I mean, my sister talked about a lot of, she even traveled, but she traveled here when her husband went to PA school, and she traveled and worked at a hospital. And so there was several times that moms were not involved or in jail or not available to take care of baby, and baby was so sick that was end up passing. She actually was the nurse that would also go in for extra time just to be with the baby on the passing day. And I was like,
Devoted.
That's rough.
similar to me.
Yeah. I mean, I think in when adults
For my adult patients.
For adults go through that sometimes, like you were saying, it's sad, but okay, most of them, especially if they are old, okay, it's not too much of a surprise, but it's a sad thing. But when it has to happen to a child, it's sad, and you have to be strong and have a strong mind to deal with that. And so kudos to you.
Well, we'll see. I might.
I think that would be very hard for me to deal with. But I mean, people can do it. With the adults, I don't have that emotions and stuff like that. Although some of the stories are sad, and you want to do your best for them, and you want the moment to be as bright as possible in that dark period in their life. But for a child, you are thinking, damn, they have all their life ahead of them.
Yeah.
How much struggle do they have to go through? And I think about all these things, and I don't want to see it.
Yes, and that's okay. You set that boundary for yourself.
But I mean, I do that with my adults. And we've had a fair share of recent comfort care and patients that have passed on our floor recently. And through the last 19 years or so, we've had some very tragic patients that we've come to really share a bond with. And so those are special times, and sometimes people are like, why do you sign up for that? And I was like, as much as it's hard, it's life and death, and I feel like it makes me uncomfortable, but I feel privileged to be part of that process of dying, and I work really hard at trying to learn if I have a person of another culture and their importance around the dying process and how to support them best. So I've had a couple experiences on that. And
it's part of it's healthcare. I mean, we do experience it. I worked in long-term care for a couple years as a CNA, and we had definitely had our fair share of passing, and it was hard. But as you mentioned, it's a privilege to kind of be there with them or with the family and support them through that time, even though it's sad. But there will always be sad moments.
Yes.
We can't avoid it.
And then this is a topic for another day, but I had people say sometimes healthcare workers kind of become insensitive to this people dying and stuff like that.
And I do believe that sharing some sadness with your patient is all right. My mom was a hospice nurse as well, so my mom actually did a little bit of everything. Hospice nurse, she did angio cath lab, pediatric, neonatal, and then she did home care. So there was a lot of death and talk about that, and so I learned really quickly that patients actually do, and families actually do like it when you talk to their patients or their loved ones and treat them as they are living, and then also have some emotions, especially if you've built that bond. And so, a patient that died several years ago, the family member that was estranged and then ended up coming around, was like, she even cried as she told me that it's nearing his death. And then all the family, all the nurses on the floor would go in there the last few days every couple hours to talk to him or make sure there's music on, make sure he's comfortable, and turn the TV back on or whatever, and tell him that we were thinking about him because he was on our floor for 6 to 8 months. And so the family knew that we all were kind of became his family. And they really appreciate that. And even though I teared up, they were like, she even got sad. I was like, sorry.
Very sad, anyway, let's pivot back as we end this conversation. So in my opinion, I'm thinking that if let's say you have a specialty and you graduate to nursing school and you get right into it and you are sure this is what you want to do for sure and you go for it and you get in there, good for you. But I also think you should be open to learning other things. You should be open to starting from somewhere that would let you learn more about other aspect of nursing, or get a foundation that will make you more rounded as a nurse. And so, what do you think? And what kind of unit would you recommend?
Oh, a med-surg floor that has a wide range of specialties that gives you a versatile outlook on nursing and your skills, and can develop your skills so that you can move on to any other place. We have several nurses that were on our floor, and then they moved on to the resource team, so they can float from floor to floor, and they love it, and they're capable of doing that. And then there's several nurses that have gone to mother baby or to children's, or have gone to the ICU and done something totally different.
So med surg usually gives you some grounding in
yes,
and some sort of acute care. I think ICU nursing it's not a bad idea too. Or what do you think? If somebody starts from ICU and like their nursing career from the ICU, do you think they can easily transition into other type of nursing?
I think going from an ICU to the floor might be a little bit more challenging, but I mean, it just kind of depends on who you are. But there's been several nurses that have done ICU for many, many years, and then decide to take a step back and become a school nurse. And it's a big change, but less sometimes they feel like it's less stressful. I was like, I don't know about that. Going to school nursing, that could be stressful. I did some volunteer stuff with my kids, and I was like, you're okay. It's just a little scratch. Can I have a Band-Aid? Yes, you can.
Oh my God. Yeah, I know.
My tummy hurts.
Yeah, my tummy hurts. What's going on? I didn't eat breakfast. I'm like, well, maybe you're hungry.
Katrina, do you have any question you would like to know? I said, a graduating student. Hey, you're almost there.
Party time.
As somebody who is graduating very soon and getting into the field, do you have any questions you would like to?
Yeah, I think.
ask?
I mean, really is what general advice would you have for new grads? Let's say with finding a job, we're finding it's actually quite competitive out there. More so than we thought. A lot of people are getting rejections from residencies. Also, my program, we don't have a practicum, which has made it a little bit challenging because some residencies require it. So what advice would you guys have?
What do you think, Daniel?
I just think, apply for several open positions that might interest you and might be something that you would be willing to look at. And see where you go from there, and just don't give up. Just keep applying and changing or pivoting if one doesn't work out, and try something else again.
Do you think we should go for a residency program, or even just apply to open positions?
As a new grad, almost everywhere you're going to go, you're going to have some sort of residency program, and you will want a decent residency program. So I do know that in, if you do a resource team, usually they will have you orient on 2 to 3 floors for about 6 months. Your first orientation on one floor will be a little bit more in depth and a little bit more training, and then each subsequent floor will be not quite as long and in depth, but you'll always have a mentor and stay there for the 6 months, and then you'll slowly move on from that. And so most resource team, it's a 2-year process, and they train you to the main topic floors, and then they will subsequently throw in a few other floors that you might be interested in, like the NICU, because that's a specialty, and then the mother baby, that's another specialty, and even not ICU, but the ER. And so if you don't really know, that a resource is a good place to try or feel it out, because you get so much versatility in between, and they do have a pretty long orientation for new grads. And most other floors, and even the ICU, does have a significant orientation. At least 6 weeks, if not 3 months, some places. And then ICU, I do know even experienced nurses go there, and it's a 3 to 6 months orientation.
Yeah.
Yeah, I totally agree with you. And I also think it's like being open-minded is very important to starting your career. Although you might have a specialty in mind, or you know what kind of nursing you want to be. Sometimes you do change. Your mind can change once you get into your foot into something else, right? Just like myself, like I told you. I wanted to do ICU because I wanted to go CRNA route. And then, but I started on acute care, and I changed my mind, just because I didn't want to be a CRN anymore, right? And I'm thinking, if I got myself stuck in something that I had changed my mind about now, I would have regretted it. I would have regretted it. So keep your options open. You know what you want to be. Like Danielle was saying, doing especially like a med-surg floor, or a floor that will train you to have skills enough to be able to transition into other specialties. I think it's a good place to start, because you can always switch. Some specialties is difficult to switch if you are in from that field going to another field. Might require a lot of training. Like I said, I do mental health and acute care, and I can see how if somebody has done maybe the mental health for 20 years, and you ask them to transition to acute care, I don't know. I have to take a lot of training.
I've heard that with labor and delivery as well. It's so specialized, and if they ever try to go to acute care, it's like being thrown into the lion's den. It's like, what is this? Yeah.
Which is why their nurses don't float to us. And yes, I had 2 nurses that I know very closely. They went from med-surg and resource team to labor and delivery, and both of them said it is way different. They had to like retrain their brains. When they had a med-surg patient that was laboring, it came helpful. But the beginning process of the laboring process and monitoring baby and mom and all the things that can go wrong and don't go wrong and the emotions was a whole new world, way different than they ever expected. But they do love it now that they've been there for several years.
And L&D nurses are great at what they do. But I can imagine the transition is very difficult.
The transition is, it could be rough, but it's doable. But again, it's so if you think you know what you want to do and you get into it, fine. But if not, have an open mind. Try something else. You might like it or you might not like it, but at least it will give you a grounds to know that I like this or I don't like it, and then you know where to go from there, right? So to me, that would be my advice to any new grad. It's like keep your mind open. Just like you said, you might be rejected from one place, or or your application is not accepted here. The world is not over,
No.
Just like Danielle said, just keep applying, and you get into.
The way I kind of see nursing, it's like might be a little tricky to get in, but once you're in and get your experience, then transferring around, you have some experience under your belt, it's a little bit easier. And
that's a good thing, right? Is that you have so many options.
Yes.
So many options, right? Even when you go to if you're doing like community health nursing, there are so many things you can do. If you're doing acute care or hospice, if you want to work in the inpatient sector, there are so many options for you. So if you want to get into nursing, please do it. If you're graduating, keep your options open. You can always move from one runward practice to the other.
Yes.
So anyway,
clinic world even.
Yeah, clinic yes, and even the clinic world, you have so many things you can do, right? So so it's a big field. Keep your options open. Get yourself well trained. I'll say get yourself well rounded. So if you want to transition, it's more easy for you to transition from one practice to the other. Anyway, so if you are with us to this time, then thank you for staying tuned to this time. We've come to the end of this episode, and stay tuned for the next episode. Thank you for staying tuned, and this is the DKA Show. See you next time. nurses with me, or let's say a student nurse and a registered nurse with me that are going to share. You see, you're laughing.
Sorry.
That's what I'm talking to you about.
Okay. Straight face.